Well, hello and good morning, everyone, and happy Friday to you wherever you are today as you're tuning in to work on this Medicare Live with me. And we had quite a few questions come in, and several of them had to do with Medicare Part D in 2025, wondering if we have any updates about that. So we know that the Inflation Reduction Act put a $2,000 cap on medications in Part D starting in 2025. And we heard some pretty alarming things about this when I was in Washington, D.C. in February, and some of those things we are still hearing. So because of the cap, we may have some carriers that pull out of Part D. I know of one smaller carrier that has already done that, looking at what it would cost and just decided that it didn't make sense. We have also heard rumors that we may see the formularies of drugs get skinnier, right? Because the insurance companies have to give full coverage after such a much lower cap than they have had before. And so that's probably the thing I'm most concerned about for all of our clients and followers here. We want to make sure that of all the years that you ever carefully reviewed your annual notice of change to see if your medications are still going to be covered by your plan next year, this is going to be the year to do that if this comes true. We have heard that premiums for Part D may triple, double or triple. I really hope that that is not true. I hope that we have some carriers that will keep some reasonable premiums for quite a while. But my concern with that is that we may see a lot of people who have Medigap, and now if a Part D plan costs $100 a month, there may be a wave of people transitioning into Medicare Advantage where they get compensated by Medicare on the A and B side and probably have a little more wiggle room when it comes to, premiums and benefits. So that is a possibility for this fall. And I know that none of this is really good news, but I'm letting you know ahead of time, and I want to make sure you spread the word because this will be probably the most important annual election period that we have seen since I became an agent back in 2004. So be sure that you're following the news here. We will have continuing updates on this. I am going back to DC this year in August to go to the Hill and advocate for Medicare's beneficiaries twice this year. And while I'm there, I hope that we'll have a lot more information. Of course, we'll bring you those updates right here in the Facebook group. So stay tuned when it comes to Part D, and I'm answering that up front just because we had so many of you ask that question. So with that said, let's go ahead and launch into some of the questions that came in. So Mary Lurby wanted to know, why do I have a copay for my medicine? And she wishes that she had stayed on some prior insurance. And so it's possible, Mary, that you have had really good employer insurance and that there were zero copays on some of your drugs. And with Medicare Part D, it's just different because there are so many different parties involved with paying for Part D. You have the general government revenues, which cover a lot of the premiums. There's your contribution to the premiums. There's the manufacturer discounts. And in order to make those drugs affordable for the public, they have gotten, help from the drug manufacturers and the insurance companies carrying their portion, but also the actual cost of the drugs that many people take on Medicare Part D far exceeds the premiums that they pay in. So it's just normal that a lot of these plans have copays. We may see the copays increase next year when the Inflation Reduction Act brings the cap down to $2,000. We will be watching that carefully along with everything, but I don't think we're going to find any plans or many plans in the future that have all these drugs that are covered at a zero premium. There'll probably be some plans that cover zero copays on generic drugs that might cost $1 or $2 at the pharmacy, so you get a slight break there. But for sure, I don't expect zero copays on medications probably ever, and so that is just the reality of it. I don't know what your income is, Mary, but if you have if you haven't checked, you can see if you qualify for extra help through Social Security. People with certain low incomes can get assistance from Medicaid in paying for some of their drug premiums as well as lowering the copays. So if you haven't checked that out, that would be a good idea. We had a question from Rod, and he says, I have Medicare Part A only. I'm still working and I'm about to retire and I will lose my company insurance. How do I find the right Medicare policy? Everyone says that their policy is the best. So Rod, if you haven't attended my Medicare 101 webinar, that would be a great place to start because we do a deep dive in the webinar about what Medigap plans cover and how they work and how Medicare Advantage plans are how they work. And there really isn't one that's better than another. I know that we have a lot of let's say, interesting conversations about this in the group. There are people that are very anti-Medicare Advantage, and then there are people that are very passionate about Medicare Advantage, and this is why we have this spectrum. So what I would say to you is, what is most important to you? If freedom of access to be able to see any provider anywhere in the nation that takes Medicare is really important for you, if you were to get sick with a serious illness next year, and the only specialist was at the Mayo Clinic, and you would want to be able to go there and have Medicare covered just like it does in your hometown, then Medicare Supplement's Medigap plans provide that widest freedom of access. If premiums are really important, if you're living on the budget, or you just maybe you don't have a lot of health spending and you'd rather have a plan with a lower premium up front and you sort of just pay as you go, then a Medicare Advantage plan might be a fine option for you. We have clients that are happy on both types of plans, and that is because at Boomer Benefits, we explain to them in great detail upfront how everything works. So check out the webinar. My team has linked that for you in the comments below. Sign up and see if that helps. And then you also can pick up a copy of the book, which is a great read. I have lots of discussion in here about how the different plans work. So if you're more of a reader than a webinar attender, that is another option for you. And we have some YouTube videos as well for pros and cons of Medicare Advantage and pros and cons of Medicare supplements. And you could watch those. And of course, always, I would recommend just give my team a call. After you watch the webinar, you'll know so much more. Then you call in and you work with one of my team experts, and they're going to ask you the right questions to find out your needs, your budget, do an analysis, and then recommend to you a plan that seems like it would be a good fit. And then if you don't like that plan, you try it. You always have opportunities to make changes each year in the fall, from Medicare Advantage to Medicare Advantage, Part D to Part D. There are some rules about Medigap plans changing. And we can cover all of that with you up front. My team is low pressure. You're not going to get hounded for a sale. We don't do that. And you can call in and just feel safe in asking the questions that you want to ask. Okay, so some questions from Ann Morton. She wants to know if she's covered through her employer's insurance, should she wait until her coverage ends before claiming both A and B, or should I claim Part A at 65? So Ann, if your employer coverage is just a standard PPO and you are not contributing into a health savings account, then I would enroll in Part A at 65, because the Part A will coordinate with your employer coverage and it could reduce your spending in the event of an inpatient hospital stay. And Part A has a zero premium for anyone that's worked 10 years in the United States or who has been married to someone who has. And so most people don't pay anything for Part A, so then that can't hurt you. But if your employer coverage is a high deductible health plan where you or your employer or both of you are contributing into a health savings account, then you're going to delay all the parts of Medicare, because you can't contribute into a health savings account if you have any part of Medicare active. Excuse me. So that would be my advice there. And your second question was about having had a liver transplant and wanting to know how your immunosuppressant medications will work. And so immunosuppressants are covered under Medicare Part B. And so if I were to run across someone and you were working with me on the phone, if you had immunosuppressant drugs, I would recommend a Medigap plan. If you have, let's say, a Medigap Plan G, you have your $240 deductible upfront. After that, Medicare pays 80% of Part B. Plan G covers the other 20%. So then you aren't out of pocket on those drugs. And so if they're costly, having a traditional Medicare plan with a Medigap would probably be a good option. If you really wanted to go with a Medicare Advantage plan, we would want to carefully look to see, what does that Advantage plan charge you for Part B meds, because many Advantage plans charge 20% for Part B meds. And so if you had an Advantage plan like that, you would pay 20% of those Medicare or those immunosuppressant drugs. So we would want to look at that. You asked a question about the deductions for a spouse for an insurance plan make much of a difference. So there's no spousal plans with Medicare. Everything is an individual policy. You have your own Medicare Part A and B, you have your own Medicare supplement, you have your own Part D drug plan. So I'm not sure if your question, Anna, is related to your husband there on the group insurance, but because we don't know anything about your group insurance, we wouldn't be able to answer that anyway. You also asked, how does one decide which insurance to go with, and does Boomer Benefits offered by some of the best insurers? yes, you can give us a call, and then my team will talk you kind of through what I told you about the immunosuppressants. And then what we would do is we would probably run quotes for plans like Plan G and Plan N in your area and take a look and see what those premiums look like. And then we also like to look and see what are the ratings of the carriers. Which carriers do we have that we can enroll you with that have a competitive premium and an A or a B plus rating? And what have their rate increases looked like in recent years? Because Medigap plans are going to have a rate increase every year. That is just normal. It happens to my car insurance, it happens to my homeowner's insurance, and health insurance isn't any different. So we want to see if we can choose one that has a long history of very stable rate increases. And then her last question is, if you have existing medical issues, should I stay away from an Advantage plan? And it's not necessarily that if you have existing medical issues that the Advantage plan is a problem. It's more that you personally, with one of my team, could open up the summary of benefits for an Advantage plan that you're interested in, and we will go through each single health service and see what are you going to pay on Plan A, what are you going to pay on Plan B, what would you plan on C. Because with an Advantage plan, first we need to make sure that we find the plans in your area that your doctors and hospitals are in the network for. We need to make sure the medications that you take are in the Part D drug formulary. And then we want to look at the Advantage plan, what they charge for you, for sure, for Part B drugs and other things that you may have. So if you have a lot of specialist visits, are you going to pay $50 every time you go see a specialist? Well, if you have a couple appointments like that every month, you might as well have done an Advantage or a Medicare supplement. And so that's the kind of deep analysis that we do with our clients. And if you give us a call, my team can totally help you with that. Linka wants to know, would Boomer Benefits follow me to other states? She is relocating after Medicare. And yes, we do business in 49 states. The only state we don't do business in is in New York. And Marjorie asks when we'll start doing business in New York. And the problem with New York is that New York doesn't like to license partnerships. And so we are not a corporation. Our structure for our business is a partnership. It's a 50-50 partnership between me and my brother. We're the sole owners of Boomer Benefits. And we have tried twice over the years to get licensed with New York, and they just won't license a partnership. So unless we go create a separate corporation just to do business in New York, I don't know when that will happen. We do, however, know a couple of great agents in New York, and we can refer you to someone really reputable. I have seen some of the feedback from the clients that we've referred, and it's always really positive, so we can get you a good person there. Kathy wants to know if there are supplements that include dental and vision. Most of the plans out there that include dental and vision, unfortunately, are Medicare Advantage plans. And I'll tell you guys, I'm very concerned that this year, because if you think about it, the Part D, most Advantage plans have a built-in Part D, and they're going to be subject to the same Inflation Reduction Act with this $2,000 cap. So I'm concerned that next year on the Advantage plans, we may see them stripping benefits away from the included dental and vision and the little extras and the perks, because they also are going to have to make up some of this spending when they have to cover 100% of all your medication needs beyond $2,000. So it's going to be a really interesting fall this year. I always tell people, don't choose your insurance based on the dental and vision. Choose what's best for you medically, either a Medigap plan or an Advantage plan. Then if you decide to go with Advantage plan, we can look to see of the ones out there who offer your doctors and your prescriptions on the formulary, which ones have the most robust dental and vision that are included. The problem is that the carriers can change the dental and vision every year. And so I don't even like to go through too much detail there, because it's only going to be valid for that 1 year, and next year they could completely change that coverage and make it not nearly as good as it used to be. Don't have great expectations of the dental and vision that is included in Advantage plans. We have some clients that have had some plans with really robust coverage, and they're really happy, and then we see that change later. We've also seen clients go in thinking they have robust coverage, and they find out that their dental plan only covers preventive care. So we want to look at that very carefully. You can always add standalone dental and vision plans, and those typically are going to have much more rich benefits, the type of benefits that you've been used to when you had this type of coverage through your employer insurance. Kathy says, when do we get with Boomer Benefits to sign up for a supplement and for a Part D plan before turning 65 so that it will be effective when we reach that age? So Kathy, it's, I would say the latest that you would call would be 1 to 2 months before you turn 65. But we have people call us all the time that are 63 and they just want to learn everything and kind of get a feel for it. They want to meet one of our agents and get on that agent's roster. They want someone they can call back and ask questions a few times before they get to Medicare age. And then they want that agent to remind them when they're 3 months out that it's time for us to apply for Medicare Part A and B and go ahead and get your everything set up. We also have people, it's really common for people that are 6 months out to call in, get their Medigap and Medicare, everything all set up ahead of time. And you can actually, in some areas, you can buy that Medigap plan. So I recommend at the latest 1 to 2 months before you turn 65. And so that is going to be completely up to you. But your initial enrollment window will start 3 months before Medicare, and maybe that's the time that it reminds you to do everything all at once. I just want you to know that if you want to call earlier with questions, you certainly can. Rodolfo says he hasn't yet completed the Social Security requirement for 40 points for retirement benefits. I'm still working. Will I qualify to enroll in Part A? So Rodolfo, as long as you have as long as you have been in the United States for 5 years, you can qualify for Medicare. It's just that if you don't have the 40 quarters, you may have to pay for Part A. So Part A in 2024 is $505 a month if you don't have the working credits. However, if you have worked 30 quarters but not 40, you can qualify for a prorate, which is about half that amount. So I'm not sure where you are, but if you're over 30, that would cut that Part A premium in half, and then you can keep working until you get enough credits to qualify. Also, you can get premium-free Part A under a spouse who has the work history, an ex-spouse who has the work history, a late spouse who has the work history, with certain parameters. So if you're going to qualify for it under an ex-spouse, you have to have been married for 10 years. That spouse has to be eligible for Social Security. You still have to be single. So if you are currently married and your spouse has that work history, your work history won't matter because you can get that off of their work history. So there's some other ways besides your own work history to qualify for free Part A. I want to make sure you're aware of those. Otherwise, you can go ahead and enroll, but just know that you're going to have that premium for Part A. And the premium lowers quite a bit from $505 to about half that when you get to the 30 quarter mark. Okay. Glad Perez says, here's a question for Danielle that I've been contemplating for a while. There's a lot of talk out there about Medicare reform, and I wonder if there's anything on the table for more preventive care. For example, physicals instead of wellness visit. Not having physicals like you were allowed before Medicare does not make sense to me. I can't agree more. I think that everyone should have an annual physical and be able to get your blood work done. Unfortunately, when they created Medicare as kind of a reactionary coverage. So you have to have this injury or illness before they're going to cover it. Now, over the years, they've added in some things that have made the preventive care a little bit better. I have not heard anything about any reform to the preventive care. In Washington, they are so focused right now on drugs and the cost of drugs that we just don't see a lot going on with the other things. And so if I hear anything like that, I will absolutely post in the group and share that with you, preventive care. But I will also take this with me, and I'm going to write it down right now because I'm making a special trip to DC to speak at a conference in August. And while I'm there, I'm going to do the normal Hill visits that I do on Capitol Hill. And usually before I go, I put a post out and say, what do you guys want me to tell them? And so preventive care is actually going to be a good one for me to mention that that would be a nice reform that we'd like to see made to Medicare. Rose says, I lived in the United States for 64 years and then I moved to Canada where I retired and I have Canadian health care. I wonder, do I have to pay for Part B since I have health care, just not employer health? So Rose, it's completely up to you. I'm married to a Canadian and I love to go up there and visit, especially we take a day trip out to Banff. It's so pretty there. But when we call them expats, when you move outside of the US, it's completely up to you. So if you think that at some point in the future, you are going to come back to the United States and live here, or you want the option if a serious health condition happened and the best specialist for that was not in Canada, but in the US, then I would enroll in Part B so that you always have at least 80% coverage in the United States for outpatient things. You would, of course, be paying premiums for that the whole time. So that's kind of what you have to weigh. If you're going to be in Canada and you like the Canadian healthcare system and you want to stay in that healthcare system and you don't think you're going back to the US, You don't have to enroll in Part B, but if you change your mind later on, there's a penalty. It's a 10% penalty for every 12 months that you could have been enrolled when you weren't. Now, sometimes you can argue this at Social Security and say, I shouldn't have a late penalty because I have maintained this national health care coverage in another state. And we have seen some people who have not been successful in arguing that. And every now and then you see someone who is, and that's because Social Security is full of human beings who make these decisions every day, and they don't always agree on the rules. So kind of a long-winded answer, but up to you if you want to keep it. And I would base that on, is it worth $174.70 a month to maintain that access to 80% coverage in the United States? Jan says, I read online that I should apply for Social Security 4 months before my birthday, which is in July, and I haven't applied yet. I get 2 months of benefits from my employer when I leave, and I hear that benefits are reduced while I'm covered for work insurance. It's fine, Jan, for you to go ahead and apply now. There's a backlog at Social Security, which is why they have recommended that early application. But if you're planning on taking it, I would just go ahead and apply now as soon as you can so that you have it. And then when you're there, you could go down in person and tell them, hey, here's the employer coverage that I have, so this is the date that I want for my Social Security to start. And they could give you some advice on which month you should apply to make sure that you hit that exact date. So that is a scenario where I would probably go down in person to set up my Social Security so that you can ask some of those questions. Connie wants to know, does a Medicare client have to pay upfront before receiving services from medical people? You should not have to, Connie, but sometimes there are doctor's offices who want you to pay them the $240 deductible. So let's say you have a Plan G or just Medicare and you owe that deductible. They want you to pay that. And that's because sometimes they assume, like they should, that coverage will go to Medicare. Medicare will kick the $240 back out to the physician. The physician sends you the bill for the $240. And everyone assumes that the person's going to pay the $240, but the reality is that some doctors' offices out there have been burned by people who don't pay the $240 and then never come back to that clinic because they don't want to face that bill. So they started asking people up front to pay them the $240. So here's what I have to say about that. I would not pay them the $240 deductible up front if you have had any other type of visit, therapy, procedure, lab test in the same week or so. If it's your first visit of the year and you go to a lab facility for testing and then a day later or the same day you go to your doctor's office, there's no telling which of those two providers is going to get processed first by Medicare. And the first bill is the one that Medicare is going to short by $240. So if you paid your doctor $240, but the lab facility is the one that they put the deductible on, now you owe the lab facility $240 and you got to chase your doctor down to get the $240 back. So I usually would protest and say that's not how it's supposed to work. You're supposed to bill Medicare, and when Medicare applies my deductible, then I'm happy to pay it. If your doctor gives you a lot of trouble, up to you if you want to pay it. Maybe you haven't had any other visits anywhere. And so you're pretty sure that $240 bill is the only one that Medicare is going to process right now. And so you're willing to risk it, not a problem. But we have people actually call into our client service team and get us on the phone and then put us on the phone with the doctor office manager to explain to them they're not supposed to make you pay up front. So up to you on how much you would want to argue with them about it. But I think it's a travesty when they do that. They should not. Okay, let's see. Jeff says, will the out-of-pocket cap next year for prescriptions include the premiums? If it doesn't include the premiums, what would be the difference in going with a low premium versus a higher one? So I don't think so. The premiums are separate and the drugs are what counts toward there. So all of them, though, will have a $2,000 cap on your out-of-pocket spending. So the difference between a lower premium and a higher one is going to be, what does that carrier, which list of drugs does that carrier offer? If you take 5 medications, what are the copays on those 5 medications here versus there? And all of those things will matter if your drug spending each year is less than $2,000, because you're going to want to try to manage that. You really want to make sure that you don't join a low premium plan that doesn't cover 2 of your expensive medications, because those medications fall outside of the cap, right? So that's also going to be important. So we want to look at the premium of the plan, We want to look at the deductible. We want to look at your specific medications and what your copays are for those medications that you take. Are they covered by the plan? And then you would make that decision for which Medicare Part D plan is going to best fit you. I'm really concerned about the skinny formularies next year. And so if you have a plan with a zero premium, I know there's a carrier out there that offered that this year. I think we'll see those premiums skyrocket next year, but I'm crossing my fingers, and I would love it if they don't do that. And if when we see that happen, we need to shop that drug plan and make sure that we are choosing the plan that's going to give us the best pricing for our medications. But there's a valid point there that if you're somebody that you know you're going to spend more than $2,000, you might be able to go with a less expensive plan. Just make sure that that plan includes the drugs you need on the formulary. Linda Beck says, is it possible in the future with Supplement Plan N that the up to $20 copay and 15% excess fee could increase? It's possible, Linda, but they would have to change the regulation to do that, and that's not how they set it up. So it's more likely that they would retire Plan N, replace it with something else, and then it has a different copay. So that is a possibility. The 15% excess fee has been the case forever and ever and ever, so I don't know that we would see it change for that reason. Plan N can be great if you're not using a lot of medical visits, and you can have a premium that is a little bit less. The other thing is Plan N, because you absorb the excess charges, sometimes we see the Plan Ns take lower rate increases from year to year. So we could look at both for you and then decide what makes sense to you. Kathy wants to know, why is United Healthcare already notifying me of a rate increase? I'm hoping it wouldn't go up, and I may be looking again this fall. So Kathy, all Medicare supplements have rate increases. United Healthcare is one where they don't limit it to once a year. So, however, on a long-term trend of their rate increases, they are quite healthy. So even though there might be 2 rate increases, sometimes those 2 rate increases might add up to what another carrier rate increase is when it's once a year. So we would want to look at that. But all Medigap plans have rate increases every year. And so, those rates go up over time, and you can shop it. So if you want to look this fall, give us a call. Now, I want to share with you, make sure you don't have to wait until fall to shop a Medigap plan. Medigap plans, you can change those any time of year. You just have to be able to answer the health questions in most states and pass the underwriting. So the annual election period in the fall is for changing your drug plan or your Medicare Advantage plan if you have one. So you don't have to wait till October 15th to shop that. If that rate went up and it's going up now here in coming into summer, let's shop it now for you. Can you outline some reasons why a Medicare Advantage plan might be the best choice for some, including the maximum out-of-pocket? I feel like some here bash good plans that might be the right option. Kathleen, I would agree. And I know this frustrates all of our Medigap policy holders. People get really, really hot about this. But here's the deal. Medicare Advantage plans were created to give you an option other than Medigap. And so for some people, they are willing to let an insurance company have the first say about their care. That's really what's going on with an Advantage plan. But here's the thing. Haven't you been on plans like that your whole life? I'm on one now. If I need to go, I remember I had a mammogram, and then there was something they found, and I had to go back for a second mammogram, and everything was benign, thank goodness. But on that second mammogram, I had to wait for my plan to do the prior authorization, and then it was approved, and it's fine. So people are concerned that Medicare Advantage plans deny everything, and that is not necessarily the case. However, there have been some carriers who were systematically denying certain procedures or using AI, like a non-human, to deny procedures. And the Senate Finance Committee and the Congress have been all over that. And there have been reforms that are happening to try to make that change, right? So one of the parts of the Medicare final rule that was just passed for 2025 is that they have to give you the same fast track appeal with Medicare Advantage that you would have with Medicare, to shorten that. So I feel like they're working on improving that. Where we see prior authorizations become a problem with Medicare Advantage plans sometimes is when you need care for skilled nursing. If you're leaving the hospital and your doctor sends you to a skilled nursing facility, those facilities are very expensive. And we have in the past seen sometimes when people have been denied access to that facility, and then their family is trying to take them home and care for them, and that is never a good situation to be in. However, I feel like they're really working on changing that. So The bottom line comes down to what concerns you the most. Listen, if I am a pretty healthy person and I don't take a lot of medications and I don't go to the doctor very often and I can get a plan that costs me zero, and I'm the dedicated kind of person that would have taken the $200 that I would have spent on a Medicare supplement and put it into my bank account where I do not touch it every month until a medical emergency. In 10 years, if I need a skilled nursing facility, I've got thousands and thousands of dollars in my medical emergency account because I have saved the money that I would have otherwise spent on a Medigap plan. And in the meantime, I got myself some dental and vision coverage too. There's nothing wrong with that. And so in this group, folks, you really shouldn't bash each other for being in one camp or the other. It just depends on what's most important to you and what can you afford. The reality is some people just flat out cannot afford a Medigap plan that goes up every month and have Part D. And now this fall, when you have Medigap premiums and now the Part D plans, if they come out and they're $100 per plan, we're going to see a lot of people change their tune about Medicare Advantage plans. So Medicare Advantage plans are not bad. They are misunderstood because you watch a TV commercial, they promise you the moon, you call, you don't bother to check if your doctor's in the network or you don't understand how the plan works, and then something is not the same as it used to be on your Medigap and you're confused and unhappy with your plan. Well, that's because you shouldn't buy insurance from a TV commercial. You should be working with a reputable agent like us who can explain all of that. So if you found a Medicare Advantage plan and that plan had a $3,000 maximum out-of-pocket limit, your total exposure for that year on Medicare Part A and B services is $3,000, period. However, you're going to have the drug plan that are separate. But that's not any different than if you had a Medigap plan where you have deductibles, copays, and coinsurance. You're still going to have the drug copays that are separate either way. So when you have an Advantage plan, and let's say you live in an area where there's a bunch of different Medicare Advantage plans. So in that scenario, we are looking to see which plans cover your doctors, which plans cover your prescriptions, and what maximum out-of-pockets do they have. And if we can find one if most of them have a maximum out-of-pocket limit of $88.50, and we can find one with a maximum out-of-pocket limit of $3,000 or $5,000, anything lower, that benefits you. And there are a lot of people that choose these plans that are quite happy on them, but they go in knowing that, yeah, it's an insurance company. They're in business to make a profit. Sometimes when I need to have a surgery or something, my doctor's going to have to do some extra paperwork. Maybe every now and again the paperwork gets denied and now I've got to call Boomer Benefits and have the claims team help me appeal. No problem. That's what we're here for. You know, we've all been on PPOs and HMOs our whole lives, and that's what Medicare Advantage plans are. So we really shouldn't be bashing them. Jim wants to know how many months before we start our Medigap plan should we contact you to have a conversation. So Jim, 1 to 2 months at the minimum. Most people contact us right when they get to their Medicare initial enrollment period. So 3 months before their Medicare date, they apply for Medicare Part A and B, and then that's when they call us. But as I mentioned to the other person that asked earlier, if you want more time, you can call us sooner. Dana says, I'm so confused by all of it. I'm on SSDI for now, and I'm about to have both hips replaced this year. Well, Dana, if you're going to be getting on Medicare and you know that those two things are coming, you might want to look at a Medigap plan, just knowing that you could get that 20% of the cost of that surgery covered. However, actually a hip replacement is probably an inpatient. So we would want, if you go the Medicare Advantage route, we want to make sure to look at the hospital copays because you're going to spend some time in the hospital for that. But if you're confused, call my team and we can walk you through everything and then try to decide what fits your needs and your budget. Christine says, what happens if I'm living in Florida, but I move to New York where Boomer Benefits doesn't practice? Well, Christine, if you have a Medigap plan, you can keep that plan when you move to New York. You're just going to have a different premium. And the premium can change based on where you live. Actually, premiums for Medigap plans in both Florida and New York are pretty expensive. So you may not see too much of a jump there, but that Medigap plan, it goes with you, and we're still your agent, but we can't help you shop the plan up there. So that's where the issue is going to be. If you have a Medicare Advantage plan and you move up there, we'll have to get you a new agent because we can't write those plans there. So we would connect you with one of those people I mentioned earlier, agents that we know very well, and we want to get you to somebody that we know is reputable and will take the same kind of care of you that we would. Pam is saying, I understand Medicare very recently approved weight loss injections prescribed by a doctor. I was denied approval through my Plan D. My doctor is going to appeal, but I'd like to know more details about the Medicare approval of these drugs. So because they fall under Part D, I think what's happening right now is the Part D plans are just automatically rejecting that unless there's a diabetes included. And so I think we're going to see appeals for quite a while. But now they have approved that for obesity, and so the carriers of these Part D plans are going to end up having to get on board. So I hope that you won't have to do those kind of appeals very much longer. But if you have your plan through us, your Part D plan, Pam, through us, give us a call and we can assist you with the appeal if that helps. Question on whether we practice in Pennsylvania and New Jersey. Yes, we are in both of those states. Cindy had several questions. She wanted to know if someone knows they won't be able to afford a Plan G or an N long term, but they have some chronic health issues that would be negatively impacted. Do you typically prefer a high deductible G or an Advantage plan? Well, Cindy, so one of the things you could do is you could start with a Medigap plan and do that for as long as possible until such time that you can no longer afford it, and then you make the switch to an Advantage plan. The high deductible Plan G is always a great option. You know that you're going to pay 20% out of pocket until you hit the deductible, which I think is $2,800 this year, and it goes up a little bit each year. I have my dad on that plan, but he also has VA coverage, so we sort of set it as kind of like a backup for him. And he does use civilian doctors sometimes, and so that on that plan at least we have the deductible to cap the spending. So that might be a plan that would work well for you if you want to stay with original Medicare. Some carriers may allow you, depending on the state where you live, to start with one plan and then go to a lesser benefit plan without underwriting. So you could start with a regular Plan G, and then if you need to some point go to the high deductible G. That is a potential option for you as well. I see, Cindy, your questions about Part D, and we answered those earlier. Some questions about the weight loss meds, and we talked about that just a minute ago. Does Boomer Benefits have a referral program? I would just say if you have someone that you want to use our services, you would just refer them to the agent on our team that helped you. There's no kind of payout for that because Medicare doesn't allow that. We can't pay for referrals. Does Medicare sell hospital indemnity plans, dental visions? Does Boomer Benefits sell them? Yes, we have hospital indemnity. We have dental and vision plans. Why can Part D plans change formulary and prices mid-year, but we can't change? It's a great question. It's not fair. And it is something that we have brought up repeatedly on our visits to DC. If you start with A and B and then you decide to return to work or rejoin spouse insurance, is it easy or later again to start with no penalty? Yes, because you would just cancel your Medigap plan, cancel your Part B. You would stay on that insurance until such time that you retire again, and now you sign up for Part B again, which creates the new 6-month open enrollment window. It's one of the very few instances where you could get more than one 6-month open enrollment window, so there would not be a penalty for that. If you get a phone call, email, or text from Medicare, how do you know it's legitimate? Do they use those methods? No, do not answer anything like that from Medicare. You call Medicare, they don't call you. And then have you seen stats on how much healthcare at Medicare rates the typical person uses each year in their 70s and 80s? I don't know any stats offhand, but you probably could find those on the Kaiser Family Foundation website. They do a lot of great research in the healthcare area. You might be able to find an article there that talks about what that spending is. We know that people who pay for Medigap plans, you're going to pay more for a plan when you're 75 than when you're 65. So if you're in the Medigap realm, we know that those rates are going to go up over time and they're going to be affected by your age. Nancy says she's been self-employed, now she's retired. She has an original Medicare and a supplement. Does Medicare require me to pay out of pocket until I reach a deductible? If so, what is the deductible? So if you have supplemental insurance, Nancy, it depends on the plan. So if you have a Plan G, you'll pay the $240 deductible upfront, and then your supplement will pick up after that. If you have a high deductible Plan G, you'll pay out of pocket until you hit the $2,800 out of pocket. So it depends on which Medigap plan that you have. Does it reset yearly? Yes. So you would pay that deductible again every year. Why doesn't Medicare cover vision and hearing? It's because it hasn't been reformed. So Medicare was rolled out in the mid-60s, and at that time, it was not commonplace for employers to offer dental, vision, and hearing insurance. So they didn't think they needed to include those things. And in fact, the American Dental Association vehemently argued against being included in Medicare. And so they were separated. Well, over time, that has changed in the employer world. So we're used to always having that coverage. And then suddenly we go on Medicare and we don't have it. And we have seen several proposals over the years to cover for Medicare to start covering that. But Medicare already has huge financial problems. And so it's just not feasible to add that without some sort of general tax increase that would have to happen or making the premiums go up. Nancy says, I'll be working, but I have purchased 2 copies of this book, with the most recent one being the one I will count on, plus a call to you, of course. Great, Nancy, I'm glad. I hope you enjoy the book. Thanks for purchasing. And Kim says, I was told I'm not eligible for Medigap because I'm too young. The question is, when I do hit 65, will I be able to change into a Medigap plan if that works better for me? So if you're on disability right now, Kim, when you turn 65, you will have a second chance. You'll have a new open enrollment. At your 65th birthday, you'll have 6 months to go ahead and get a Medigap plan with no health questions asked. So you'll be in good shape there. I've seen a couple of questions about the ACOs, and we just don't really know a lot about them. We see that more and more of the doctors are joining them. We haven't really seen complaints about how it's affecting healthcare. So we're kind of in a wait and see mode with the ACOs right now. I understand the reasons behind why they're trying to do them, to control costs so that they can make your Medicare dollars go further. But it's something that we don't have a whole lot of data yet on how it's the long-term impact because it's relatively new. Is it easier if both spouses are on the same supplement plan? Beth is asking that. Definitely not. When we run the quotes for you, if the same carrier comes up as the cheapest for both of you, then great, because some carriers will offer a household discount. So what we want to look at for you is, does being on the same carrier provide you the least overall out of pocket? But if a different carrier has a much lower rate for you, and it actually would be you would have a lower total premiums by you going with one carrier and your spouse going with the other, then no problem to be on separate ones. Everyone's an individual when it comes to Medicare supplements. So we just want to look at the premiums and see if it makes sense. What are the requirements for transitioning from Medicare to Medicaid in New Jersey when you finally run out of cash, and what is the best way to prepare? Find a local expert. I would start, Robert, with the Department of Health and Human Services, finding out from them, what your requirements are for applying. I'm not sure if you've already done that. And then the main thing with Medicaid is that you're going to be seeing doctors that have Medicaid. So if you're over 65 and you have Medicare, you're going to have basically both Medicare and Medicaid. Medicare pays primary, Medicaid pays secondary, but now you need to make sure that you see providers who accept both Medicare and Medicaid, so it can limit somewhat the circle of providers that you can see. And I would contact your local department there to get the information, because Medicaid does vary by state. Joanne says, in case our state legislators decide to give seniors a break and make available guaranteed supplement issue birthday rolls, if we are currently paying more due to underwriting, we'll be able to keep the same plan but pay at no underwriting level, or we have to switch plans to another company to take advantage of the no underwriting. So you would have to be in a state that has, like, say, the birthday rule. So taking California as an example, in California, if you already have a Medigap plan, you have a limited window of time each year where you can change to a different Medigap plan of lesser or value, equal or lesser, with no underwriting. And so in that scenario, you would want to do it within that particular window. Otherwise, if you're in a state that doesn't have that and you want to switch plans, you're for sure going to go through underwriting. So we would want to go through the health questions with you first, see if we think you have a good chance of being approved, and of course, never cancel your existing coverage until such time that you can know or be approved by the new coverage. Do you have to go into Medicare if you have outside insurance through your husband's work? No, you do not. If your husband's work has more than 20 employees. So if he works for an employer with 20 or more employees, then his insurance is going to be primary and Medicare is secondary, and you can delay enrollment into Medicare if you want to. If it's a small employer, though, with less than 20 employees, you need to sign up for A and B when you turn 65. And Sherry says, can I enroll within my 6-month initial enrollment period on December 1st of 2024 to start Medicare and my supplemental insurance on January 1st? Yeah, so Sherry, you have a 7-month initial enrollment window for Medicare. If you enroll in the 3 months before your birthday, then you cannot do that. Your benefits will start on the first of the month in which you turn 65. If you enroll in your birthday month or the 3 months after, then your benefits will start the first of the next month. So it's going to depend where you are within that window. But let's just say that you knew that you needed your insurance to start on December 1st or January 1st. If you need a January 1 start date, if you're applying in the last 4 months of the 7-month window, you want to apply in December for your benefits to start on January 1st. And my team can walk you through that to make sure that you do okay in figuring that out as well. And then what is the deadline date of my initial enrollment period for Medicare? I assume the new deadline to start supplemental insurance. So you have 6 months from your Part B effective date to get a Medigap plan without any underwriting. And I think that's what your question was there. Now let's dive in here and see some questions that we've had come in while I've been here. Nathaniel is asking, do some employers pay a percentage of retirees' Medicare premiums? They're not supposed to, Nathaniel. So if you're still actively working, they're not, it's technically illegal for them to do that unless they set up something called an HRA that they run the premiums through, which we rarely see those. So what we've seen a lot of employers do is just give their employees extra pay. They give them a raise or a stipend of some sort to help, so the employee then pays their own premiums for Medicare. But if it's a retiree plan provided by your employer, then yes, of course, then they're paying some of those premiums and you just pay your portion. Susan is asking, can you explain the difference between Medigap and supplemental? So they're the same. A Medicare supplement and a Medigap plan are the same thing, just 2 different terms. So you have Medigap, Medicare supplement on one side is an option, and Medicare Advantage is another option. So those 2 are the same, Susan. Sue is asking, should we contact Boomer Benefits every year to see if we're still on the best plan? I'm currently on a supplement starting 6/1. Yeah, when you get your rate increase, Sue, which you'll usually get like in the 11th month of your policy, you should always call our retention team and have us shop to see if we can find you a better rate. And then if you can pass the underwriting, or in some states they don't have any underwriting, we would help you with making that change. I have a couple that's been working with me almost since the very start of our business. And he and his wife have called every single year, and they're in good health, and they always change, even if it saves them $5 a month. And I'm sure that the combined savings of that over all those years is substantial. Steve says, what do I do when I'm overcharged for my doctor visit with my $240 deductible? Steve, if you have your policy through us, call into our client service team, 817-249-8600, and we will get involved and take it from there. If you don't have your policy through us, then you have to work that out with your doctor. So I would get your Medicare summary notice that shows what you should have owed. Take that in, sit down with the doctor's office staff and say, here's what Medicare says I owed and you're overcharging me. Why do I owe X instead of this? That's the kind of detail that you'll have to get into if you don't have access to our service team, but that's the way I would go about it. Jody wants to know, could a new administration hang or kill these potentially significant benefits to seniors that don't take effect until 2025, 2026? Well, the Inflation Reduction Act is already passed, and so these things are going to happen in 2025 and 2026 regardless. Could there be additional legislation that modifies that? I suppose we don't see that happen very often, though. I'm more concerned about actually what's going to happen to your premiums and your formularies when all of this takes place. I do not think that it is necessarily going to be good. And if what we see is across the board, people are now paying $100 or $200 for a Part D plan that covers less medications, fewer medications than it used to, then we probably would see either Congress under either administration take some action to fix what would be an unintended consequence of that. We would hope that is what they do. If all of a sudden we see a bunch of carriers say, peace out, we're not doing Part D anymore, that also would be something that's kind of alarming. And that might be when we see legislators step in But I think the 2,000 is that's going to be solid for 2025, even if the administration changes. It's not the kind of thing that you can change with just an executive order. Let's see. Susan wants to know if you have Medigap, do you work with Blue Cross? We work with Blue Cross in some states, so it just depends on the state that you're in. Blue Cross is one of those where you have to do a separate contract in all the states, whereas somebody like United Healthcare, there's one contract that covers all of it. So it depends on the state, Susan, but you can give us a call and we'll check with our team. And Rocky is asking, if some Advantage plans cover you outside of your local area, then why am I paying so much for my plan and supplement? That was the reason I chose the supplement. Cover you outside your local area, then why am I paying so much? Okay, so Rocky, if you have a Medicare Advantage HMO, with an HMO, a lot of times you have no out-of-network coverage unless it's an emergency. Now, you could look at a Medicare Advantage PPO, and with a PPO, you can go outside the network, and it will usually be at additional cost to you, and you have to make sure that the provider outside the network is willing to be able to plan. Not all of them are. For example, the Mayo Clinic in some locations will not accept Medicare Advantage. They won't build a plan, even if you had a PPO. So it depends on where you're trying to go there. So if the savings is substantial, one of the things that I like about Advantage plans, or I recommend for Advantage plans at Boomer Benefits, is we love the big national carriers. So if you take a carrier that is in every state, and you guys know who these carriers are, the same big carriers that we've always had our eye on, they do all the business in the under 65 market, and they do the business everywhere else. So if you have one of those carriers and they offer plans in every single state, and you know that you're going to spend 3 months in Tennessee this year visiting your kids and your grandkids, and while you're there, you want to know, is there a doctor you can see that's in the network? Well, a lot of times that same carrier that offers a Medicare Advantage plan in your area will have a Medicare Advantage plan in the other state. And with these big companies, we have this thing called network reciprocity. So we can call in and conference them in and find a doctor who's in the network in that area and get you in there at an in-network rate. But that isn't going to be something that's feasible and usable all of the time when you have a serious health condition and you're needing to be treating with the same group. So it really just depends on what's most important to you. For sure, with your Medigap plan, you have the widest freedom of access. You're not going to run into hospitals that will not take your coverage. With an Advantage plan, you will find providers out there that in some areas will just not take Advantage whatsoever, and that means you can't go there unless you want to pay out of pocket. But if you're okay with just using your coverage occasionally, we can set you up with a large national carrier where you've got some network reciprocity, and we would just want to talk through which carriers would make the most sense for you, so you could reach out to my team for that. A question from Alan, what is the biggest mistake people make when initially enrolling in Medicare at 65, other than not calling Boomer Benefits, of course? Thanks, Alan, I appreciate that. There's a couple. So the biggest mistake that people make is not starting their research early enough. You should be researching this at least at 64 and a half. I think you should be learning Medicare when you're 60, because decisions that you make when you are 63 and 64 with your finances can affect your premiums for Medicare when you're 65 and 66. So let's say that you took a giant severance pay when you're 63 and that made your income skyrocket. Well, now when you're 65, your Part B is going to be more for a whole year because of that big check that you took. If you sold a piece of property that had a big capital gain, they may look at that and be like, yep, you're going to pay the IRMA for a year. So people don't start their Medicare research early enough, and that's where they get into trouble, of course. The other thing we see is sometimes people who are still working, they'll ask their friend that goes to their ladies' luncheon or is in their church, hey, you're on Medicare and you're still working. Did you have to sign up for Medicare? No, I didn't, and there's no penalty. My agent told me you're good to go. Okay, well, the person asking works for a small employer, and they're asking this of their friend that works for the large employer, and the friend with the large employer doesn't know that the rules are different for people under 65. So we see a lot of people with small employer coverage who fail or COBRA who fail to enroll in Medicare Part A and B, and then they end up with a late penalty and a gap in coverage. So Medicare is primary when you have small group insurance or when you have COBRA. And in either of those scenarios, you need to sign up for Medicare A and B as soon as you're eligible. So that's one of the mistakes we see a lot. And then with the Advantage plans, we just see people calling the commercials. They call those commercials, and we have to fix those problems every single time. It is so annoying that happens. So please don't ever enroll in coverage because you saw a TV commercial with a celebrity of some sort telling you that if you find this plan tomorrow, there's going to be a new Lexus in the driveway. Okay, we should know that we pay for. Let's take a look. Well, how does this plan work? Are my doctors in the network? Are my drugs on the formulary? And then make sure that you enroll with someone who can help you on the back end, of course, just like Alan said. So those are some of the things that we see. Okay, I think that we have gotten through most of the questions here. I'm just going to scroll through and just see if I missed any. And of course, if I did, my team will find those, you guys, and they will reply down below your comment, and we'll make sure to get an answer for you. I did see a comment in here that Glad put, and she said that her employer used to have an HRA where they had the $3,000 in premiums that you could use for insurance, and someone else had a question about that. So you can have the employer set up a health reimbursement account and put money in there that then you can use to pay for that. It's just that we don't see a lot of employers actually doing it unless they're a really large employer or somebody in their benefits department is really savvy. And I think that people should do it more because if I'm still working, I would want to take advantage of that as well. Let's see. Can you discuss excess charges and Plan N? People are concerned that they could be charged 15% on lots of things. Yeah, we get that question too. So here's how it goes. If you have a Plan N, you're responsible for your own excess charges. You're only going to have excess charges there's some states that don't even allow them, first of all. So go to our website. We have a page about that. You can find the blog. It'll list the states where that's not allowed. But let's say you're in a state where it is allowed. Okay, so the easiest way to avoid all of the problems is to ask your provider, whether that's a cancer center or a hospital or a doctor, a specialist, a physical therapist, whatever, hey, do you accept Medicare assignment? If they say yes, there's never going to be an excess charge. Okay, now if they say no, you have the option of asking, hey, am I going to be subject to this 15% excess charge if I treat with you? Yes, I am. Okay, this is something I need to consider. What we normally see, so if you have chemotherapy and the bill is $100,000, that's not what they actually get paid. Medicare first discounts that rate heavily, right? You have a much discounted rate just because it's Medicare, and then you have the 15% excess on top of the Medicare rate. So they can't just blow the rate up 140% and call it an excess charge. That 15% is the limit. And so you just ask that question when you're going in, and sometimes it might just be a doctor and you're like, I don't mind if I pay the 15%, it's not a problem. And other times, it's something bigger and you want to check ahead of time. Also notice that excess charges are only on Part B, right? So you're not going to have an excess charge on any of your Part A charges like hospitals or skilled nursing stays. And those are the things that typically are the most expensive. So not really a worry there. Plus you have the difference in premiums that you're saving. So I like Plan N. Sometimes we see lower rate increases each year from Plan N to Plan N. Not all the time, but we're starting to see some of that. So I've been kind of watching that to see if that's something that we need to do additional videos or information on. So Plan N should be something that you consider and talk it through with our team. And let's talk about your medical usage and then see if it is going to be something that's going to be a problem for you. Okay, woo, that was a Medicare craziness. I hope that you've enjoyed answers to your questions. Thanks for being in here and participating in the group. We really appreciate it. We will definitely be doing more of these where you'll have opportunity to win prizes and ask some good questions. And then don't forget, you need to really be paying attention to the content in the group and our YouTube channel as we get closer to fall, because I will be doing more and more I will do more and more content regarding everything that we're hearing about Part D right up until those changes are there. But I think more people than not this year really need to look at it and potentially shop their plan. So we want to stay on top of that and make sure that you're looking out for it. All right, guys. Well, I hope that all of you have a great weekend, and I'll see you again soon. Bye-bye.